patient had just had both of his legs amputated.
This is Dr. Janea Calderia.
I'm a family practice physician in San Diego.
And she's talking to producer Alec Opperman about how her patient's insurance denied her request for a wheelchair for a double amputee.
The reason was because I didn't specify how his walking would be affected by his disability. So I had to call and fight this and tell these people, my patient doesn't have legs.
Dr. Calderia is referring to something called prior authorization, an approval doctors like her need to get before insurers are willing to pay up for certain procedures like medications or a medical device like a wheelchair. Stories like this got us wondering, why are these obviously necessary procedures, medications, devices, etc. being denied? So we went searching for a reason. Is it run-of-the-mill evil? Is it fraud? And if so, who exactly is responsible? But what we actually found was a grift that, while totally legal, surprised us at every turn. I'm Andrew Rivera from More Perfect Union, and today we're uncovering the scam behind prior authorizations. A lot of our digging was inspired by the story of a woman named Kathleen Valentini.
She became our client in 2019 when her husband, Val, called me and said, "I want to tell you a story."
That's Steve Cohen, the lawyer for the Valentini family. Kathleen was a retired teacher living in North Carolina when her hip started to hurt. After it didn't go away, her doctor ordered an MRI, but the prior authorization was denied.
The insurance company said the MRI was not medically necessary. The appeal of the denial of the MRI took 5 weeks, and Kathleen finally got the MRI. And when she did, it showed that she had a fast-growing sarcoma, a cancer, in her hip.
Kathleen saw an oncologist, but the 5-week delay meant that the cancer had spread. Instead of just needing chemo, she needed to have her entire leg amputated, all because of her delay in getting a prior authorization. As we looked into it, stories like Kathleen's seemed all too common. The American Medical Association found that 80% of doctors report that patients have abandoned their treatment because of the prior authorization process. 19% say they've led to life-threatening events or required an intervention to prevent permanent impairment or damage, and that's exactly what happened to Kathleen.
And her husband could not believe that an insurance company had the power to overrule the doctor's recommendation.
Most shocking, however, is why the insurer said that the MRI was not medically necessary. In Kathleen's case, it meant that she hadn't done an essential step before getting an MRI. She never went to physical therapy. Except she did.
The doctor said, "Guys, not only she finished the 6 weeks of physical therapy, you paid for it."
Insurance companies claim that prior authorizations save patients from unnecessary procedures and prevent fraud. They also claim they adhere to clinical guidelines set forth by professional organizations of doctors themselves. In cases like Kathleen Valentini, we wanted to know, are insurance companies just lying? And who's doing this? Like, who is the person who sits down and sees Kathleen Valentini's record and decides to just hit denied? So we talked to someone who might know.
I had teams ranging from 4 or 5 people all the way up to 20 plus reporting to me at different times. I was on the business operations end of our organization.
This is Max, not his real name or voice, who worked at a company whose whole business was prior authorizations. Oftentimes, insurance companies can't handle the sheer amount of requests, so they outsource the decisions to a company like Max's. It wasn't actually Kathleen's insurer, Emblem Health, that denied her MRI. It was a company that Emblem Health had outsourced their prior authorizations to. Max was quick to defend most of the nurses and doctors reviewing prior authorization requests. What he described instead was systems designed at all times to look like they were simply adhering to best practices. But that stripped employees of the ability to practice good judgment. Instead, companies like his used hostile design to push the kind of large-scale outcomes they wanted.
There's not a whole lot of room for subjectivity in some of these tools. And so like, I can't check that box or I can't fill in an answer here. That might be enough to fail that clinical algorithm.
So I want to ask, for Kathleen Valentini, do you have any guesses as to like why that might happen?
I mean, only speculating here. but they might not have entered all the information inappropriately, or it might not have been explicitly called out in the place that they would have expected to find it in the clinical documentation, in the clinical notes.
To summarize, if Kathleen's doctor didn't write that Kathleen had already done physical therapy in wherever some anonymous doctor was expecting to see the words, "patient did 6 weeks of physical therapy," the insurance doctor, rushed for time, might have overlooked it. Had Kathleen's doctor placed that crucial component somewhere else and maybe circled it with some big arrows or not had to do a prior authorization at all, Kathleen might not have lost her leg.
When you say like they're basically doing things that are just short of fraud, like what do you mean by that?
It's almost like selective design in terms of, do you want to word this question in a tricky way that maybe makes it a little bit more difficult to someone not paying close enough attention, and then likely leads to them not getting an easy approval.
But while Max consistently stressed how their decisions were supposedly rooted in best practices, story after story from doctors highlighted a system that was comically inept when it wasn't just outright horrifying. Dr. Calderia once ordered a mammogram for a patient with a carcinoma. The insurance initially rejected the prior authorization after a worker didn't understand basic medical terminology.
The person who is reviewing this case didn't know that carcinoma is also cancer.
In another case, Dr. Calderia looked into a doctor who kept rejecting her submissions. She had found he switched to insurance after receiving a multitude of complaints against him to the medical board. Others just seem not worth the effort. One doctor complained on social media about needing a prior authorization for a cheap blood pressure medication that only costs a few dollars a month.
I just got a prior authorization from United Healthcare for Lisinopril. I hope the whole board at United Healthcare gets diarrhea tonight.
Steve Cohen has one answer to make sense of all this.
Insurance companies have used a strategy for the last 20 years that's known as deny, delay, and defend. It comes from a McKinsey recommendation that said if you deny care, some of it will just go away.
Max had never heard of the term deny, delay, defend, but said it was an unspoken understanding in his line of work. They would never say, let's deny more requests, but would say, let's send more requests to review, knowing that the outcome was the same. And when that happened, patients might give up, or end up switching insurers, or end up in a new year with a new deductible to hit. But more shocking is that companies like Max's aren't just grifting patients, they're grifting the insurance companies themselves. Let's take the wheelchair example. If Dr. Calderia didn't properly document how having no legs impaired her patient's walking, she might resubmit with a nice little summation of how her patient could not, in fact, walk without legs.
We did 2 reviews in that case, the initial review and the subsequent review. And it doesn't matter that both were for the same patient because in our data, we'll have 2 requests. And when we're reporting value to our clients, most of the decks that I had seen were showing things like denial rates and then how those trended over time.
Those denial rates were simply calculated with the number of denials divided by the total number of decisions. In other words, those 2 separate requests for a wheelchair end up looking in a spreadsheet like a 50% denial rate. It doesn't matter that the patient got the wheelchair in the end, that one denial that delayed care by days or weeks helps crank up his company's denial rate. Multiply that by thousands of denials which eventually get resubmitted, and Max's company can claim that they've saved the insurance company millions of dollars that they actually haven't. Meanwhile, patients like Kathleen are dying or becoming disabled. At Max's company, there was a balancing act between selling their cost savings to insurers and angering groups of providers who might leave the healthcare plan. At some points, they were told that they were denying too much by their clients.
We would make decisions on how much volume we send to be reviewed by our nurses and our doctors for given health plans based off of whether or not we've got upcoming contract renewals. The thing that's bothersome is that those are decisions that are made based purely off of money and business relationships as opposed to prescriptive patient outcomes.
Kathleen's family sued Emblem Health and eviCore. Among other things, Steve Cohen argued that they had committed fraud and medical malpractice, but they didn't get far.
During the very first conference with the judge said, "What happened to Kathleen Valentini is tragic, but there's no law in New York, none in the federal system, that holds an insurance company accountable."
I mean, to be honest, I can't even count the number of lawsuits that came through in the time that I was there. But I don't remember any of them wherein we were found to be liable.
Kathleen was eventually killed by her aggressive cancer. Steve Cohen thinks her insurer shares the blame. There's currently an unprecedented amount of public pressure against prior authorizations. Patients, doctors, and lawmakers are outraged by stories like Kathleen Valentini's. In our own research, we learned of patients left with permanent incontinence because of delayed imaging, and others who go malnourished and need surgery after insurance delays leave their inflammatory bowel diseases untreated. One woman spoke to us and said her experience with prior authorizations through private insurance ruined her life as she battled a rare disease that left her bedridden. Over 30 states have introduced legislation trying to fix prior authorization. Drawing from the American Medical Association's guidance, many of the bills required 24-hour response times for urgent care and 48 hours for non-urgent. The AMA also recommends making prior authorization information public, something that Vermont already does. There's also legislation that's been stalled in Congress. Many of these recommendations could save the lives of people like Kathleen Valentini, but they may not be enough. Max wonders if prior authorization is useful at all based on his experience in the industry.
It's just unnecessary. There's no direct line that leads to any kind of evidence of improved health outcomes for the patients.
The excuse that insurance companies use for prior authorization is that there's rampant waste and fraud. That is simply not true. In a $1 trillion industry, the amount of fraud is a tiny, tiny percentage.
Steve Cohen has another idea: what insurers used to do, and what Medicare still does: pay and chase. You pay for medical services and then go chase people down who have committed fraud.
It does not get between the doctor and her patient. It is approved, it is paid for, and then the worst offenders are audited.
In Steve's vision, doctors can make their own calls and bad ones will get punished. It's not perfect, but it's better than putting a company whose sole duty is to its shareholders in between you and your doctor. A company that, in the case of Kathleen Valentini, courts have ruled has no obligation to care for your health.